Closed captioning for Justice and Law Weekly is provided in part by the Clifford Law Offices in support of quality public television for the Chicago area.
I'm Aurora Abella Austriaco, President of the Chicago Bar Association. Healthcare touches everyone's lives. Costs keep rising, and the population is aging. Joining us to discuss these issues is Dr. Roberta Luskin-Hawk, President and Chief Executive Officer of Preston St. Joseph Hospital, Chicago. Prior to her appointment as CEO, she served on St. Joseph's medical staff for 24 years, helping to found one of Chicago's first inpatient HIV units. She also served as Chief of Infectious Diseases and as Chairperson of the Department of Medicine. Dr. Luskin-Hawk earned her MD from the University of Illinois College of Medicine and completed her internal medicine residency at Michael Reese Hospital and Medical Center in Chicago. She also undertook an infectious disease fellowship at the University of Chicago Medical Center. Welcome, Dr. Luskin-Hawk.
Thanks for having me, Aurora.
I know as CEO of a hospital, you're pulled all over and you're traveling all over, so having you here is really, really greatly appreciated. You're CEO of St. Joseph's Hospital Presence, which is actually a pretty large healthcare network. But I wanted to go to St. Joseph's Hospital. It's been around for a while, I think dating back as 1868. Can you tell us a little bit about St. Joseph's Hospital?
I'd be happy to. As you mentioned, St. Joseph's Hospital was founded in 1868 by the Daughters of Charity. They came in the midst of a cholera epidemic and started by renting a small house to respond. It's been in its current location since 1964. It actually has a long tradition of reaching out to some of the most vulnerable of our patients. We had one of the first inpatient psychiatric units and the first TB unit, and as you mentioned, one of the first HIV units. Today, I think what we pride ourselves in are several things. One is we're an active educational environment. We've got 6 residency programs with over 140 residents. But we also really pride ourselves in providing very high quality care right in patients' home community. With a focus on a number of programs varying from women's health, our newborn nursery, our oncology programs, orthopedics, and day-to-day issues. So we really deliver a full spectrum of care that really address probably 98% of patients' needs. So we're very excited to be doing that.
Yeah, I do have a long history with St. Joseph's, being that I've had relatives who used to work there, and I'm very familiar with quality of care. It is a pretty good, hospital. Before joining the staff at St. Joseph, you founded Lakeshore Infectious Disease Associates. What inspired you to found this practice?
Well, it was interesting. When I was in medical school and residency, I was fascinated by really the detective work that was required to investigate and understand infections and how they manifested themselves, and the ability to use those kind of critical thinking skills to solve the puzzle. It was really detective work and to make a difference. Often you had patients who were in life-threatening circumstances, and by doing things well, you could really have a huge impact on their lives. So the work we did was broad. It included general infectious diseases, but it was also right in the midst of the HIV epidemic. So a significant part of our work was to respond to that, both in clinical treatment and research.
Right, and that's what led you to actually found one of the first inpatient HIV unit at St. Joseph?
Yeah, at that time, St. Joseph was one of the leaders in providing HIV-infected patients with care, and inpatient treatment was needed. We're pleased that most of the care today is provided to outpatients. We still have a huge commitment to patients with HIV and keeping them healthy for long and productive lives.
Right. Well, your work didn't stop there with HIV. You went on to found another organization. Can you tell us about AIDS Research Alliance?
Sure. AIDS Research Alliance Chicago was founded as an independent, not-for-profit community AIDS research organization. And so we worked across the city with a variety of sites, both private practices, but also Cook County Hospital and University of Chicago, University of Illinois, came together to bring research out into the community. Up until that time, the NIH-funded research required that most patients go to a university setting. And we found that for people of color and women and other people who may be economically disenfranchised, that was a huge step. And so our consortium actually brought research to the patients where they were getting their care. And we're really proud of the additions we made that helped advance the information and the care of patients with HIV.
Right, right. And that actually is very fascinating to know that you are bringing the research into the community, the underserved community. And I think with St. Joseph also, that is still the mission, that you want to bring into the community the services that you provide.
Absolutely. I think that at St. Joseph we believe that we can be really accessible, easier to navigate, that we really are working to develop teams to provide very coordinated care, to make it easier for patients to have access to really exceptional quality care.
Right. You mentioned earlier about a women's center. Tell us a little bit more about that.
Yeah, well, I think there's a variety of issues in women's health that the hospital is trying to address. Two of the areas that are most cutting edge, one is our gynecologic surgery program. So we have a large, what we call a minimally invasive surgery program, where women don't have to have the big scars and the long postoperative recovery that they used to do. That with robotic surgery, which we are leading in many areas, and with even other types of minimally invasive surgery, women are having wonderful outcomes, fast recovery. So we're very proud of that. We're currently doing a research study on a novel approach to robotic surgery called single incision robotic hysterectomy, and that started recently and is really cutting edge in the country. In addition, we have a level 3 perinatal facility, which means that we take care of some of the most vulnerable early premature infants. And we were given that designation based on a track record of over 20 years of doing a wonderful job with that. So we're very proud of that as well. So that if women hopefully are going to have a normal delivery, we're there to serve them, but they know that should they become high risk or should there be complications, that we're well prepared to take care of the women and their child.
I'm not surprised then with the next point that I'm going to make, that you were appointed Executive Vice President and CEO of the hospital in 2009, but you're only one of 4 women physicians to actually rise to that position. That is pretty impressive. And you know, in a healthcare industry, there's a lot of women, but we only have 4.
Yeah, it's interesting, and I think that what is becoming evident is as healthcare is becoming more challenging, having a physician CEO brings just different insights that are additive to the other administrative duties. And it happens, I guess, women physicians and women physician CEOs are currently relatively rare. I expect to see more in the future.
Right. Well, good. I look forward to having a lot more, but I'm so proud and really glad that one of the 4 is actually here I'm interviewing. You mentioned about robotics,
yes.
Robotic surgery. That is something that is very cutting edge. And tell us a little bit more about that. Is St. Joseph the first hospital to actually have that? One of the first few?
Well, we're not the first, but we have the latest technology, so that there were other early adopters who did pioneer the way. We're fortunate that we were able to bring it in as the technology moved forward. What's interesting about robotic surgery, actually at first the sound of it can be almost intimidated.
Scary, actually.
You don't want the idea of a robot doing surgery, and it certainly does not.
Yeah.
What's interesting about robotic surgery is that there really is a machine that supplements a highly trained surgeon's technical abilities. And the reason it can do that is it allows for instruments to enter the area that needs surgery through very tiny little incisions, and the instruments are manipulated by the surgeon. So the surgeon's manipulating everything.
Right.
But there is no tremor because of the way that they're designed.
Right.
And they have the ability to really turn 360. So if you're a surgeon doing surgery, you're limited by the range of motion of your wrist and the size of your hands. And by using this technology, which is called a robot, you're actually using very tiny little pincers that you control completely, but they have tremendous flexibility. And so where it's been useful, and you have amazing visualization. So with the robot, you actually have 3D visualizations as opposed to some of the earlier generation ones. It's particularly good in pelvic surgery, gynecologic surgery and prostate surgery, in areas in the pelvis where typically it can be harder to get big hands in, a little harder to see. Here you have wonderful visualization and control. What it means to people who have the surgery is really that rather than having a large incision, that they leave the hospital the same day or the next day, that the pain is minimal compared to having a bigger incision that has to heal. Their return to normal functioning is much quicker, so that the outcomes really are fabulous. And so we have many very satisfied patients after that surgery.
Right. Now, that surgery, is that covered by insurance?
Absolutely.
Well? Okay.
Absolutely.
Great, great. Now, St. Joseph is now part of a Catholic not-for-profit hospitals known as Presence.
Correct.
And when did that happen? And I guess, why did it happen?
Wonderful questions. In November of 2011, Resurrection Healthcare and Provena Healthcare merged, and the merger came together for a variety of reasons. And in healthcare, it's becoming clear that if you want to be able to create new programs and do new things, that there is an advantage of scale, and that leadership can really make a difference across a large organization. As we look at bringing in technology, whether it's electronic medical records or other things, there's also value in having a larger organization. So both organizations really merged as equals and came together as Presence. You probably haven't heard much of us. Actually, the first part of the merger was really coming together, and that takes about a year to organize. The second part of the merger is actually the really exciting part. We're using this opportunity of coming together and what's happening in healthcare to truly transform the organization. And you'll be hearing more about Presence and the role we want to play in the health of the community over the coming months. What I think is happening in healthcare is there's a recognition that we shouldn't just be focusing on reactive care, taking care of someone in the hospital when they're already critically ill. That as a country and as an organization like Presence, that it's really important that we address preventative care, and we become much more than a hospital system. We become a true healthcare system to promote health and to promote wellness. As a country, I think the shift is in that direction, because despite how much we spend in healthcare, we're not the healthiest country. And it's going to take a paradigm shift to really looking at how do we partner with the community and our patients and help them live their healthiest and best life. So I think you'll hear more about how we're going to take that on as Presence Health. And I think the importance is that we have a very important mission to serve all people, including people who are medically underserved. And we want to be able to do it in a collaborative, respectful way as their partners.
Right. And I think that is really important because, you know, the regular folks, lay people like me who don't know much about, you know, the hospital setting, I wouldn't go there unless I'm sick or something. But the way your approach is collaborative community work, bringing it out to the community, I think you're going to find a lot more partners. And it's not just the community, but you've got the other trades, the other organizations actually coming in. I'm assuming that's the focus that you're looking for.
Absolutely. I think we'll look, you know, partner with other community organizations, with educators, with the business community. We just finished something called our Community Health Needs Assessment, where we really met with a variety of organizations to better understand the needs in our communities and how we can really approach them together.
Right, right. Since being appointed as CEO, I know you launched an electronic record system, which is the most advanced in the nation. Can you tell us a little bit about that?
Absolutely. Actually, through the Affordable Care Act, hospitals and organizations were given some support to make this happen, because it's a huge undertaking that is incredibly expensive. So we took that opportunity and worked with a company called Epic that's really known for excellence in their record and has won many awards. We went hospital by hospital, but for St. Joseph, it really meant in May of 2011, we converted entirely to this electronic system. Where that's important, and I think the true value is not only that you have legible records, but that it really is a platform that creates an opportunity for wonderful team-based care. That the physical therapist and the physician and nurse are all working within the same system, can see each other's notes in real time, and work together. More importantly for the patient, besides the fact that we now coordinate care better and there are safety checks built into the record, is that patients will have the ability to access their information as well. So I think that it's a very robust platform. We're still working with it to make it more powerful and more impactful.
Right. Now you touched on the safety checks on that. Obviously, you want to make sure that the records are, protected and safe and not subject to being tampered with. And that's exactly the security that you're mentioning.
Right, and the records are safe, but actually what I was even referencing is also the patient safety. So now when a patient gets a medicine,
Got it.
It's barcoded in the pharmacy, the nurse scans it, they scan the patient's wristband before giving it to the patient, and should, for some reason, not be the medicine to that patient, the bar scanning will immediately give them an alert, so that there's there's technology that's enhancing the safety of our patients.
Right. Now, the bracelet that you're talking about, is that already out?
Yes.
Patients already have it?
Absolutely.
Okay.
It's really an ID band similar to what they used to have, but it's barcoded now.
Yeah. Do you find that a lot more seniors are using it more than the rest of the population?
Well, actually, I should have clarified. That's just when they're an inpatient.
Oh,
so they get it when they're in the hospital, and we just use it at that time.
Got it. Okay. Now, St. Joseph recently became the first hospital in Chicago to have the hush curtains. Tell us about the hush curtains. It's a lovely title, but it's got great use.
Well, we really try to listen to our patients and hear what they need to have a more comfortable experience with us, and we really want them to feel well cared for and have their privacy honored. So in certain areas in the pre-operative recovery area, it's not unusual to have rooms divided with a curtain. And the curtain gives you visual privacy, but didn't provide the type of sound barrier that we wanted. And so that the experience was a little noisy. And we found this technology where sound insulation is actually put between two layers of fabric. And so the curtain, which is called a hush curtain, provides a sound barrier. So it provides more privacy, but also more quiet when people are in those settings.
Yeah, and this is under your leadership, which is amazing. Is this a result of the community survey that came out? Or
well,
where did this idea
we actually
come
do
from?
patient satisfaction surveys, and we try to ask about various aspects of their care. And truly, one of my vice presidents heard about this technology and brought it to me and said, maybe we can make this environment even nicer for patients.
Yeah. Well, I do have to say that, when a patient comes in, sometimes their biggest complaint in a hospital is they wait too long. Just to check in, from checking in to another facility to another site, and then eventually the doctor sees them. Normally, average time on that is probably, an hour, 2 hours, 3 hours? But that's different at St. Joseph.
Well, one area where people particularly are aware of wait times is in our emergency departments. And so, especially with the recent flu epidemic, it's gotten in the press. And we pride ourselves on the timeliness with which we treat patients. And in fact, even advertise our average, what we call our door-to-doctor time or door-to-doc time, is less than 20 minutes. So that is for a patient to come in, see the nurse, get a quick registration in the ER, and actually see a physician on average. And the last time I heard it was 13.5 minutes. So we really try to be responsive. As you enter the hospital, there's a different registration process, and we're always looking for areas to tighten that up. But our new ER is actually something that if patients have the need for emergency services, I think they'll find that it's an exceptional setting in that we really designed it for comfort and quiet in mind, and recognize that it didn't have to be scary and loud and institutional looking to create wonderful care. And also we're fortunate that we've got wonderful physicians and staff and the ability to serve people very quickly.
Right. Now, Roberta, what about the challenges in healthcare for 2013? I know we've got the new Obama healthcare law and all that. We can't cover all of that, obviously. But what do you think are the challenges in the healthcare system?
I think we really have to do two things. For those patients who need inpatient care, we have to provide the highest quality in a coordinated, cost-effective way so that we are making sure that patients get what they need and they get it promptly and they don't have to spend unnecessary time in a hospital. No one wants to be there. Right. So that's one challenge. So it's really about coordination of care and safety. I think the other that's facing all healthcare systems is understanding how we start looking at care from the point of prevention and what care we can provide when patients are outpatients or at home, how we work effectively with them. The country is also facing societal issues in terms of obesity and diabetes, and so working together with non-healthcare, non-traditional healthcare organization, whether it's schools or others, to look at how we can become a healthier country.
Right, right. And you did mention that we spend so much in healthcare. I think we are probably the country that spends the largest, but yet we don't have to show that we're the healthiest. Right.
So we do some fabulous things, and never to minimize the wonderful care that can be provided, the cures that happen. Right. But at the same time, there's so many people we don't reach, and there's so many preventive things that we're not doing well enough. So our whole orientation and the way we were paid to provide care was about responding to sickness. Right. And there's really going to be a shift, and there is a shift, that the way we'll get paid for care is to help people remain well, do wonderful preventive work, and partner to avoid unnecessary hospitalization. So it can be something as simple as for women, I think people start worrying about osteoporosis often when they're older. Right. And yet the goal would be to make sure women get their calcium and vitamin D and know not to drink too much soda when they're younger. Right. And you can prevent a lot of things that way. Right.
So that means you're going as young as maybe the grade school, right?
Absolutely.
Especially in those communities that are, underserved.
Correct.
Okay. In 2011, U.S. News and World Report included St. Joseph Hospital as one of its top hospitals in the nation. That's a pretty great honor. And that's under your leadership.
We're very proud of that recognition. We're fortunate. We're kind of an untold story. So many people don't know us, but we are judged by our outcomes, and we very consistently show. And it's on Healthcare Compare, that our outcomes for patients who have the kind of things that people get most, heart attacks and pneumonia and heart failure, are better than national averages, are better than would be expected. I think we've recruited a wonderful group of physicians, in part because of our teaching programs. We also have a beautiful location, and so we're doing really good work to the extent we can get the word out, and only enhance it further is what I'm looking for.
Yeah. Now, when you say the outcome, is the outcome of non-recurrence that's factored in as well?
I think the outcome on the website is even mortality. So it's the absolute outcome, right? Living or dying. When you come in with a high-risk medical condition, we do exceptionally well with that. But in addition, trying to manage relapses, prevent relapses on some diseases that are chronic and severe, that can be quite challenging. On others, it's easier. But having that view of the world where you're not just treating the acute episode is important.
Right. Now, the Presence organization, how many hospitals do you have now under that Presence?
Well, there's 12 hospitals, and in addition to the 12 hospitals, we have nursing homes, assisted living, home health, hospice. It's a huge organization that really, and many now physicians who work for us. So it's an organization that spans the continuum of care, kind of from the doctor's office all the way to the hospital and beyond. So we're very excited. It covers a large part of northern Illinois and some of central Illinois.
Which is a pretty wide span of geography. You're going to be very busy, right? Going real quickly back to infectious disease, because that seems to be your specialty. I just heard on the radio about this superbug that's out there. Tell us a little bit more about the superbug, which is resilient to most of the antibiotics that we have.
Well, and we actually hear about superbugs periodically. I think when we think about bacteria, we have to remember that evolution is ongoing, and that when bacteria are exposed to a lot of antibiotics, that there is a selection of those more resilient and resistant strains. And we try to keep up by coming up with new medications. But I think that the important principles are a couple. One is that really to reserve the use of antibiotics only when they're absolutely needed. Occasionally patients will come in and have a cold and say, oh, can't you give me an antibiotic? And the doctors have to resist the temptation just to satisfy the patient and really educate. Right. The other is hand washing, and even at the health club, using those wipes to wipe down. Yeah, it's important.
Right. Yeah. Now, with regards to the healthcare, which is really a big unknown at this point, how do you think, or what impact do you think Obamacare will have on your hospital, on Presence? Really not just yours, but in general.
I think acute hospitals will have some challenges because we're only going to get paid for things that go really well. So it's a challenge that I think we have to meet, and it's important. I think in general, in principle, I think we have to cover everybody and that we have to deliver health care to everybody. In fact, we were in some ways, but we were doing it only when they got really sick as opposed to preventing them from getting really sick. So I believe in principle it's absolutely what we need to do. And really with both the Affordable Care Act and the way insurance is changing, everyone is challenging hospitals and healthcare providers to provide value, not just volume. So it's not a matter of just being paid for every visit. It's really going to be paid for doing things well and for patients doing well. And I think that in the end, despite some of the challenges of getting there, it's where we need to be.
Right, and again, it circles back to preventative care.
That's a big piece of it.
If you go back there and help them early on, you're not going to have the heavy load up front for the sickness.
Right, and then for the people who are sick, you'll have the resources to treat them well at the same time.
Right. It's exciting with your leadership at St. Joseph and with Presence. I'm sure you're going to go ahead and we're going to see a lot more great things come out under your leadership, and we're looking forward to seeing you with regards to that. I wish we could have more time, but the time goes by really fast. So thank you for coming. Dr. Luskin-Hawk, thank you so much for being here with us today, and I look forward to having more conversations with you.
Well, thanks for having me. I really appreciate the opportunity.
Thank you for joining me on the Chicago Bar Association's Justice and Law Weekly.